Hello again, everyone. We are doing a series on your consultation where we're trying to teach you how to help yourself. And one of the reasons is because we get so many people who they are not getting what they should get when they are seeing people that they entrust to take good care of them. So I'm trying to help teach you because knowledge is power, and you need to ask questions and you need to know what's the right thing to do. And so we're going to talk in this one about peri and postmenopausal. How do I deal with my hormones? And why do I care about hormones? Because look, they have done a huge amount of scientific studies and showed that even in twins, that show that if one twin is on the antioxidants and the hormones, etc., and the other one is not, the one that is not ages much more quickly, and most importantly, their brain ages infinitely more quickly. So I care about your hormones, and so should you. Because quality longevity is part of my mission for each and every one of you. Preventing disease, slowing down the clock, all of those things. So, peri and postmenopausal. We all know that if you start to have night sweats, what hormone goes down first? In some people it's DHEA, in some people it's progesterone. Okay, so you go to the doctor and you say, I have these symptoms. If they're not doing your blood levels, that's a major problem because everybody's different. Did your DHEA go down first or did your progesterone go down first? DHEA, which comes out of your adrenal glands, is anti-aging, pro-immune system, and anti-stress. And who is not hugely stressed out? One of the reasons that I give people Adrenal Life Force is it helps support the adrenals and DHEA. Why do I have DHEA support on my website? Because there are a huge number of people, even younger people, who need DHEA, but you need to do a blood level of DHEA and see, and the blood test that you do is DHEAS, S as in Sally. And if you don't do the right DHEA blood level, then you're not going to get the right result. You're not going to get a result that tells you whether or not it needs to be treated. So DHEA and that impacts your testosterone. Testosterone helps you with motivation, helps you with your brain, helps you with your bones, helps with your skin stay volumized and make new collagen, etc. So DHEA is essential. So progesterone, you start getting night sweats, your progesterone's going down. You're exhausted, etc. You really need to look at your DHEA level. If you wake up in the middle of the night, 2 o'clock, and you're like, why am I awake? You're not sweating, but your brain is wide awake. Number one, you make sure your adrenals are good, your thyroid, because that helps all your hormones be good longer. Okay, helps your body make more hormones, and that's a good thing as long as possible. But you wake up at 2 o'clock in the morning, it's your estradiol. Now, a lot of people struggle horribly with their weight, increasingly in today's world. And so what I do, and also because I'm treating the skin as well, so one of the first things that goes down, your estradiol may stay good for a long time, but your estriol, and why do I have estriol support on the website? Estriol support from the time you're late 40s is going down. That's the estrogen of young women. It helps plump up your skin. If your vagina is dry, your estriol is low. Estriol support, you can put a pump in your vagina every third day, and it moisturizes it. You put it on the surface of the skin. You can mix it in with my skin products, or put it on top of other skin products, although I hope that they're non-toxic. And estriol support helps plump up your skin. It helps get rid of wrinkles around your mouth, on your neck. It helps your whole skin be better. So I often will use in women because women make estradiol for a long time after they've gone through menopause. Some women longer than others. The ones who struggle with their weight, they usually are high in estradiol, and you do not want to give them that. You want to give them estriol, not only for their skin, their vagina, but also if they're having any symptoms, day sweats, waking up in the middle of the night, hot, and usually I will have already treated their progesterone because progesterone, again, is one of the first hormones to go. But I'm looking at their blood levels, and I'm looking at their blood levels of DHEAS, estriol, estradiol, progesterone, free testosterone. If you're looking at total testosterone, it's useless. Free testosterone, and I'm looking at their pregnenolone, and I'm also looking at their growth hormone because growth hormone goes down and that makes everything bad as well. But estriol support is one of the first things that people start to use, not only for your skin, if your skin is dry, if you're starting to get more lines, progesterone support, okay? It's a low dose. If women struggle with their weight, I like to use the low dose first because I start off with 1 pump at bedtime if they have night sweats. If that's not enough, then I go up to 2 pumps at bedtime. A lot of times I will go up to 1 pump twice a day because it's better to try to keep a smoother blood level. But you can go up progressively every 2 weeks till your night sweats go away with progesterone of 1 pump twice a day, 2 pumps twice a day, 3 pumps twice a day would be the most. But then I've added in estriol support as well, not only on their skin. That's 1 pump. I start off with 1 pump a day. Again, I always use it on the face, eyelids, neck, hands, because I'm plumping up the skin and helping with their estrogen levels. Now, a lot of people will use, this or that herb, et cetera, Will it help symptoms to a certain extent? Yes, but it's not helping your bones. It's not helping your brain. And it's not going to be strong enough, which is why I have those things on the website and why we put these videos and why we put all the information we have on the website about how to start and advance estriol support, DHEA support, okay? DHEA support is, I usually will get a DHEA level virtually always. If people are older, well into their 50s, not that that's old, but into their 50s, I'll start with DHEA support 1 pump every other day. Too much DHEA if you don't need it. If you don't have a blood level, too much DHEA, you'll get a blackhead. You'll get 1 little pimple. You stop using it, it'll go away. It means you have enough DHEA. Some people have enough DHEA, which is why you need to do blood levels. So if you go to your doctor and they're not doing a estradiol, progesterone, DHEAS, as in Sally, free testosterone, at least those blood levels, then shame on them. And you should insist that you have those done. And then you treat accordingly because you have to treat all the pieces of the puzzle. If you just treat estradiol and progesterone and you don't look at the other ones, you can gain weight, you can not achieve the goal, you're not helping your bones, and you're not helping your brain, which is why you have to look at all the pieces of the puzzle. And it's why I've given you these things on the website, which are non-toxic, because a lot of times, and you should never take oral estradiol. Never. No one increases the risk of cancer. So absolutely you should not do that, which is why I have estriol, progesterone support, and a lot of compounding pharmacies are mixing hormones in with creams that are incredibly toxic and inflammatory, which is why I have those things available to you and why I'm trying to teach you why this versus that and how to help yourself and how to help you help your doctor. Okay, so hope this helps. We're always trying to help take care of you, and thank you so very much for giving us the opportunity to do that. Thank you.